Insulin resistance in fat cells affects blood vessels, ovaries, brain, liver, muscle, and kidneys. Dr. Ben Bikman.
In the case of hyperplastic adipose tissue, the size of the fat cells enables healthy normal vascularization and healthy normal gas exchange. In contrast with significant hypertrophy of fat cells, the fat cells are becoming increasingly too distant from capillaries, and they become hypoxic. In an effort to resolve that hypoxia, the fat cell is secreting cytokines, some of which will hopefully induce the production of new blood vessels like VEGF, or vascular endothelial growth factor. The consequence of this throughout the body is that now we have more cytokines flowing through the blood, increasing, albeit to a subclinical state, inflammation. So if we put all these ideas together, the hypertrophic fat cell is what's becoming insulin resistant. And in the process, it is leaking free fatty acids and it is leaking pro-inflammatory cytokines. This then is spilling into the tissues downstream of the fat. When the blood vessels are becoming insulin resistant, they've lost their dynamic nature, where insulin is normally inducing vasodilation, and now it cannot. And so the blood vessels are staying constricted when they should be dilated. This, of course, exacerbates hypertension. In the ovaries, the hyperinsulinemia and the insulin resistance in the body is inhibiting the enzyme aromatase, which is preventing these estrogen spikes that are necessary for ovulation, thereby preventing ovulation, and at the same time resulting in an excess release of androgens, causing some of the inconvenient, awkward physical manifestations that accompany PCOS. Now, when insulin resistance reaches the brain, that is thought to be a fundamental cause of Alzheimer's disease, or at least part of it, to the point that some refer to Alzheimer's disease as type 3 diabetes. That is to say, insulin resistance of the brain. When the liver becomes insulin resistant, its handling of fats, what it's making and storing, as well as what it is packaging and releasing in the form of VLDL and HDL metabolism is changed, driving dyslipidemia. When the muscle becomes insulin resistant, among other consequences, the muscle will start to become sarcopenic because of the loss of insulin protecting muscle proteins. And then lastly, on just a short list of examples, the kidneys are retaining too much uric acid and thus driving gout.
Insulin resistance in fat cells affects blood vessels, ovaries, brain, liver, muscle, and kidneys. Dr. Ben Bikman. Hyperplastic adipose tissue and blood flow. The size of fat cells helps in normal situations. Vascularization and gas exchange. In contrast, fat cells with significant hypertrophic tissue, those fat cells are too distant from capillaries, so they become hypoxic, lacks of oxygen. So, the fat cells secrete cytokines like VEGF to produce new blood vessels. VEGF, vascular endothelial growth factor, a signal protein that stimulates formation of blood vessels. The consequence of this for the rest of the body, we now have more cytokines flowing throughout the blood, inducing inflammation. Dr. Bikman summarizes, hypertrophic fat cells becoming insulin resistant and leaking free fatty acids and inflammatory cytokines. These spill into tissues downstream of the fat cells. When blood vessels become insulin resistant, they have lost their dynamic nature for vasodilation, which is widening the vessels, exacerbates hypertension. When ovaries become insulin resistant and have hyperinsulinemia, this inhibits enzyme aromatase, so it prevents ovulation and excess release of androgens, causing PCOS. When the brain becomes insulin resistant, This is the fundamental cause of Alzheimer's disease. When the liver becomes insulin resistant, its making of fats and its packaging and releasing LDL and HDL is changed, driving dyslipidemia. Dyslipidemia, abnormal levels of lipids like cholesterol, triglycerides. When muscle becomes insulin resistant, it becomes sarcopenic due to the loss of proteins. When kidneys become insulin resistant, they retain too much uric acid, thus driving gout. Annotated and summarized, easy to share with loved ones. To access these annotations, go to doctorstotrust.com or see the description below this video's title.